All right. Hi, Hillary. How are you?
I'm good. How are you?
Good. So I just wanted to welcome you and kind of figure out a little bit more about what's going on and what brings you into services here today. So if you just want to start maybe with your demographic information, like your background and kind of what's going on with your family.
Yeah, thank you so much for asking and reaching out. So we just moved to the urban area outside of Greater Grand Rapids for my husband's job.
Sure.
With our one child, looking for in-home care to help with a recent autism diagnosis.
Okay. Okay.
That brings us here today.
All right. Absolutely. Well, thank you for sharing that with me. And how recent was that diagnosis?
Within the last 3 to 6 months.
Okay. All right. And was that at your previous residence then in which you received that diagnosis, or in that county?
Yep. Recent county.
Okay. All right. And so why don't you tell me your first name again?
My first name is Hillary.
Okay. And then your date of birth or just your age?
32 years old.
Okay. And do you have any spiritual beliefs or affiliations at all?
A believer, not any set denomination.
Okay, perfect. And what about any cultural values or beliefs that may or may not play into that?
I think one of the important things to note being in West Michigan is that I am half Black and half white. There is no part of me that is white passing.
Sure.
So being in a community that is, predominantly white,
Sure.
Dutch, getting outside of Grand Rapids,
right.
Our lived experiences can be a little bit different
Sure.
for myself. My husband is white and our child, is very white passing. So
sure,
they seem to blend in very well, whereas
sure.
I can stick out a little bit.
Right.
And emotionally, I can feel that even if it's not explicitly said.
Oh, absolutely. No, I think that's important. So we definitely want to get you and your family set up with in-home services that you can feel comfortable with on that standpoint. And also that kind of just coincide with a lot of your cultural beliefs or ethical beliefs as well.
Yeah.
And then let's just talk about the home environment. So I think you touched base on it. You said that you were living outside of Grand Rapids or the Greater Grand Rapids of Michigan. And you just moved there, so I'm assuming that you wouldn't have any satisfaction in terms of living in that community. Any reports of how are your neighbors or anything like that? Have you guys really had a chance to settle in, or not quite yet?
Not too much, especially being in the winter, these colder months. But we are comfortable here. We feel safe and secure.
Okay, good.
And we do see, periodically people, even in the colder weather, out walking their dogs. Good. So that gives us hope that there's activity, even if it's not a close-knit area, there's still activity going on.
Right. And that's important because you want to feel, culturally competent and also welcomed in a community. And sometimes in these winter months, it's really hard to feel that way. So I'm glad that you're able to see that in your neighborhood right now. And hopefully it'll be a good fit for you and your family.
Thank you.
So I just want to reiterate again in terms of the reason for services. So you stated that there was some diagnosing or testing that was done in your previous county. You had moved to this county due to your husband's employment services. You guys are kind of just getting acclimated with services at this point in time, or wanting to get acclimated with in-home services in the new county that you're in. And then I did notate that it is important for you to culturally be in a community or with services that make you feel accustomed to your race and your ethnicity, being half white and half Black as well. Yeah. Is that correct?
Yeah.
Okay. Okay, perfect. And then do you think that there would be any safety? I think you touched base on this too. No safety concerns, whether that be inside of the home or with the neighborhood residential area at all, correct?
No safety concerns.
Okay, and then we can discuss insurances too. I mean, I'm sure they'll get a better feel for that, but do you have insurance at this point in time?
We do through my husband's employment. They were very accommodating, offering it shortly into new employment.
Sure, great. No, I think that that'll be very helpful too. Is there anything else that you feel would be imperative for us to know in terms of any common factors that you may need or that we should know in regarding the in-home based services?
I don't think so.
Okay. Okay. All right. So I think I have enough information in terms of what we need here today. I just also wanted to kind of make sure that the childhood experiences, so you two are both married, you're married, is that your correct status there?
Yes. Yeah.
Married. Okay. All right. And just one child at this time. How old is your child again? I'm sorry.
He is turning 5 in just
Okay.
a couple of months.
Perfect. All right. And then there have been no previous trauma or any issues within the home or within the past, let's say about 3 to 5 years. Is that correct?
Correct. Yeah.
Okay. All right. And at this time, is there any other minor events or important events that we would need to know about for you or your husband?
Nope.
Okay. All right. I think that is reflective on the information we need, and we will kind of go through a checklist. I'll send you a survey at the end of this, just so we can kind of get some feedback and make sure that we're doing everything that we can to refer you on to appropriate and home-based services. I really appreciate your time here today, Hillary, and thanks for meeting with us. We hope you have a really good rest of your day.
Thank you so much.
All right, take care.